Hi, my name's Joseph from Mental Health Europe, and today we're going to be discussing personal recovery, what it is, how it might benefit you, and what to look out for when you begin your own journey. Before we dive into personal recovery, let's take a look at what recovery means in general. Recovery is a word that gets used a lot, but it can mean different things depending on who's saying it. For example, you might often hear of something called clinical recovery. It's a term often used by doctors and usually means treating or reducing symptoms and helping someone to return to what would be considered a normal level of functioning. Personal recovery, on the other hand, is something different. It's a deeply personal process that connects to your values, goals, and life experiences. It's not just about getting rid of symptoms, but rather about building a life or existence that feels meaningful to you, even if the challenges you are facing continue to persist. So what exactly is personal recovery? One of the best known definitions comes from William Anthony, who described it in 1993 as a deeply personal, unique process of changing one's attitudes, values, feelings, goals, skills, and/or roles. A way of living a satisfying, hopeful, and contributing life, even with the limitations caused by illness. However, through our ongoing work, Mental Health Europe has developed a more recent, rights-based perspective, adding that recovery is a process that empowers people to live full and meaningful lives, even with mental health challenges, based on protecting, respecting, and guaranteeing their human rights. This process builds on individual, family, and community strengths, and promotes equitable access to resources and supports that respect the autonomy and dignity of each person on an equal basis with others. It's a journey rooted in strengths, be it your own, your communities, and your relationships, and it respects your dignity and autonomy every step of the way. Recovery is personal, and so is what you are recovering from, be it mental health problems or other issues such as addiction. To start with, there are some things you might think about that can impact your chances of recovery. The stigma and discrimination that often accompany these experiences, the impact a diagnosis might have on us and our personal identity, whether services may have been unavailable when you needed them, or if they failed to live up to the promise or potential, whether mental health systems that can sometimes feel impersonal, overly medical, or hard to access. Recovery is about finding ways to deal with all these experiences and building a life that's defined by you, not by a label or someone else's expectations. Through the work done to define personal recovery, some core principles have been established. These are what are called the CHIME framework. The 5 letters stand for connectedness. This describes the sense of relationship and community we feel with others. You may feel this is missing. Making sure a recovery plan that prioritizes peer or community support could help you. Hope. An important part of being able to move forward is to believe that it is possible. This might not always seem obvious, but it is important to come to the realization that it is possible. Identity. Many of us often feel that we lose our sense of self, either through the experience of mental health issues or through its diagnosis. Recovery can often focus on trying to help maintain, rediscover, or see beyond for a new identity. Meaning, what gives your life purpose? Recovery may involve rediscovering that, or finding it for the first time, whether through work, creativity, faith, or connection. Empowerment. This means building confidence in your own ability to shape your future. It's about finding your voice, making your own choices, and being supported to grow. So how do we go about starting the journey to personal recovery? First, reflect on what we've discussed already. Has any of it resonated in any particular way? Personal recovery is exactly that, personal, and identifying the aspects of recovery that apply directly to you is an important first step. It's important to remember that this can be a slow and sometimes frustrating process as we discover what does and doesn't work for us personally. Next, you can explore what tools or resources are available to you that might help. Organizations across Europe have created support networks that might be able to help you. Checking with your doctor or a local community support group might help. You will be looking for such things as peer support or recovery colleges. A full list of organizations available in your area is on our website. To help in understanding what it is exactly you might need, here are some additional questions you might think about or ask. What personal recovery looks like for you? Who do you trust enough that you could talk openly about this to? What's been helpful in the past? What hasn't been helpful in the past? What one thing could you start doing today that would make things just a little bit better? The answers to these questions might begin helping you understand what kind of personal recovery or network of people you might be looking for. The important thing to remember is that despite personal recovery being an individual journey, it is not one you need to venture alone. Many different people can be there for you during this time, whether it may seem like it right now or not. You might be here because you know someone who might be struggling, and you're wondering what you can do. Here's a few things to keep in mind when supporting someone on the journey of personal recovery. Be sure to respect their changing sense of self. As we went through in this video, this journey can be a tough one, where old attitudes, meanings, goals, and so on change for an individual. As such, it's also important to remember that some changes may need to be made in your own life, as wanting to go back to the way things were may conflict with the changes that are needed for the person you care for to lead a happier life. This can often be a difficult thing to help someone with. Keeping informed, as you are doing now, is a great start, but you shouldn't be afraid to also seek out external help. For example, a family or peer support worker. Just make sure you do not share private or identifiable details without the consent of the person you are supporting. It's important to keep lines of communication open, even if you feel you might not say the right thing. Your presence may help in alleviating feelings of isolation and uncertainty. Finally, it's important to look after yourself. As much as this is their journey and can be tough on them, so too is it a journey for you. One you likely have not faced before. Be sure to give yourself the time and space to breathe and take breaks. It's not selfish to do so, it's essential, as your deteriorating well-being could impact your ability to help. Recovery is a very personal process that allows us to live full and meaningful lives. Regardless of whether we live with any mental health challenges, it's based on protecting, respecting, and guaranteeing our human rights. It builds upon our individual, family, and community strengths. It helps with better and fairer access to resources and support that respect your autonomy and dignity equally. We hope you found this video useful. Subscribing to the channel, liking and commenting on the video can help us bring more stigma-free mental health information to the platform. Thanks for watching.